Welcome to Mile High Living. I'm Sam Boik. Thanks for joining us today. For over 50 years, Boulder Center for Orthopedics and Spine has been serving patients in Boulder, Broomfield, and the entire Front Range. As the region's most preferred orthopedic practice, they offer the latest in joint replacement and revision techniques in their state-of-the-art facilities. We recently took a trip to their Boulder location. Take a look. Tell us one common injury or maybe many common injuries that you see, and what type of assistance treatments do you offer?
Yeah, sure thing. I try to think of pretty much any injury that patients have as falling into a bucket that can either be conservatively managed, meaning no surgery, or surgery. And my goal for everybody, if we go to the operating room, is can I make you better? So I can make a lot of patients different, but not everybody can be better with surgery. So non-operative treatment is a great place to start for almost any injury. Something that I see a lot, particularly here in Colorado, people are very active, skiing is very popular, would be an ACL tear. That's a very common injury. And even ACL tears, people think automatically, oh, I have to have surgery. That's not really the case. If you're being really active and doing things like skiing, you may be a little bit more inclined to have surgical intervention for something like that, but you can function just fine without an ACL. So we have a discussion always, what are your goals? How much functional trouble are you having right now? What can we get you back to? And what would your outcome look like if we treated this conservatively or with surgery? And like I said, I always offer non-operative management because not everybody's going to be a good candidate for surgery.
Tell us about orthobiologics and how do you incorporate that into your practice?
Yeah, great question. That certainly falls into the category of the conservative or non-operative management. There's a lot of different types of orthobiologics, and we can get into that a little bit, but that is a great option for a lot of people if maybe they're not a great surgical candidate or they want to try everything they can to stay out of the operating room. That's a great place to start. So you can do stem cells, you can do PRP, you can do hyaluronic acid, which is a gel or a lubricating type of injection. And those are a really great option for us. So things that we offer here would be the platelet-rich plasma, the PRP, and the hyaluronic acid. Like I said, it's a gel, it's a lubricant. It can kind of help patients that are having some arthritis or some wear and tear of their knee or their shoulder, and they're not quite ready to make that jump to a joint replacement, because that's a big surgery too. All surgery is inherently risky. And if you just have a little bit of arthritis, but a lot of pain, something like an orthobiologic can be really helpful.
Let's talk about labral tears, because some very popular sports like racket sports, we're talking pickleball, tennis, for a lot of folks, they might experience a labral tear. How does this occur, and what are some of the symptoms of a labral tear?
Great question too. So the first thing we need to talk about is what a labrum is. So if you think about the shoulder, you have a labrum of your hip too, but the labrum of the shoulder, like you're talking about, you have a ball and the socket joint for your shoulder. The labrum is a soft tissue ring that goes around that socket, and it helps to deepen the socket and make a nice suction fit for the humeral head, the ball part of that ball and socket joint. So if you think about every time that humeral head, the ball moves around, it can put some stress on the socket. So overuse, overhead activities, the tennis, the pickleball, those sort of sports can sort of wear and tear on the labrum. You can also have acute trauma that results in a labral tear. If you fall and have a shoulder dislocation, that can result in a labral tear. Consistent pain is certainly something that people have with labral tears, sort of a grinding or a catching sensation. If you have a dislocation that leads to your labral tear, if you have instability, like you raise your arm up overhead and you feel like your shoulder is just moving around on you, that usually can indicate that you may have a labral tear. We would get an MRI almost always to make sure, and that can really help guide our management. But a lot of labral tears can be treated without surgery, which is something, again, similar to an ACL tear. People think, oh, I have a tear, I have to have surgery to fix it. That's really not the case. There's really only a certain subset of people that have labral tears that need surgery. So we'll definitely talk about injections, therapy, activity modification. What can we do to make you better by keeping you out of the operating room? But there are certainly labral tears. If you're having the instability, your shoulder dislocates a second, third, fourth time, that sort of leads you down that path like, okay, we should maybe talk about going to the operating room. But it is a very common injury, but more often than not, it's something that does well without surgery.
You just mentioned MRI. I understand that you have a new MRI in Broomfield at that location. Tell us more about what's available there.
Yeah, that's going to be a great addition for us because we already have a lot of things that we offer at the Broomfield location. We have our clinic there, we have x-ray machine, we have physical therapy, we have our surgery center there. So we have almost everything there that you could need. And now with the addition of the MRI, it's very nice because we do have patients that we see in Boulder at our Boulder location, but a lot of patients that come to the Broomfield location live a little bit further east, a little bit closer to that office, And it's way more convenient if you can get your clinic visit, your MRI, your PT, and then maybe ultimately your surgery all in one location. That's really nice. It also, our schedulers do a great job of scheduling both your MRI and your follow-up appointment. They send the imaging and the report right to us. So it's really a nice closed loop.
And doctor, let's talk about physical therapy. How does this play a role, and is it important both pre and post surgery?
Yeah, absolutely. It plays a vital role. I get to do the fun construction work on the patients in the operating room, but really the work comes both before and after with the physical therapist. They have a very intimate relationship with the patients. They're seeing them once, twice, 3 times a week, whereas I see them every couple of weeks. And so they really get to hone in and help develop a relationship with the patients and get them to where they need to go. Physical therapy beforehand seems sort of counterintuitive, but we call it prehab. And what that does is it can help make sure that you're set up for success after surgery. So is your swelling decreased? Do you have good motion before surgery? Because that can be very indicative of what your motion and your strength is going to be like afterwards. So it's hard to get buy-in sometimes from people to go to rehab before surgery, but it can make a really big difference too. And then afterwards, that's like I said, that's everything. My job is very small compared to the role that the therapists play. And having that offered both at our Boulder and our Broomfield locations, it's amazing. I have therapists that can walk across the hall and come say, hey, do you mind taking a look at this patient? Or they'll send me a message and say, hey, this person's doing great, or I'm a little worried about this patient. What can we do differently? And it's a very good collaborative effort.
Wonderful. Thank you, doctor.
Absolutely.
Now, to learn more about Dr. Schryver and his specialties, visit bouldercenter.com. That's also where you can find details about the orthopedic care services provided, like Mako Smart Robotics Technology, MRI scans, orthobiologic injections, and more. They paid for this segment. Stay with us.